All right, let's shift gears to a story that has essentially gripped the nation. We're talking about Hantavirus. So, a luxury cruise ship, and you've probably seen this story by now, a luxury cruise ship hit by the Hantavirus outbreak is raising questions about the potentially deadly illness. The ship was due to head to Spain, was marooned for days off the coast of Cape Verde with close to 150 people on board. Three people aboard died, while others are still receiving care. And we've seen video come in from folks on that cruise ship. A scary situation for those folks there. Today on the program, we have Dr. Nazario Rivera-Chaparro, pediatric infectious disease at Novant Health here on Live Impact News. Thank you for joining us. Again, a lot of questions regarding what hantavirus is, and I just want to start with that one. What exactly is hantavirus?
I mean, if we talk about hantavirus in general, it's a pretty broad term because hantavirus is sort of like a subset from a really big group of virus called the Bungi virus. But the thing about them is that they're very specific because they're part of a group what we call hemorrhagic fever virus. So they tend to cause these more severe presentations, not like your common cold kind of viruses that cause like, your snotty nose, your cough, headache, mild fever. These types of viruses are a little bit more on the severe end. And hantavirus in general, we kind of make it into a small group, but there are different depending on the geographic disposition. So, we divide them up between old world and new world. And in the new world, we'll talk about in North America, Canada, Mexico, and South America. We have a little bit more of a severe presentation, which we call hantavirus pulmonary syndrome. And that one's the one that causes a lot more mortality compared to the old world, where we see more what we call hemorrhagic fever with renal syndrome. But they're basically just it's a big group that has a lot of different subsets depending on where you are in your location geographically and what type of rodent is associated or caused the infection, right? Because that's the biggest thing about hantavirus. It's really rodent based, right? So it's not like we'll say like COVID or the flu, where you see a lot of person to person transmission. It's what we call in the ID world a zoonotic disease, meaning that it requires an animal to actually serve as the vector, and we get it from that animal.
And I'm sure you've gotten a lot of questions since this story unfolded about it. I think a lot of people, if you remember back, like were introduced to what this is when Gene Hackman's wife passed away. We heard the term, and now this, and I keep hearing rare.
Mhm.
And again, you said hantavirus. You're talking about something. It's a very general term, but when you hear rare, or when people hear rare, what does that mean when it comes to this?
Well, it's not something that you would easily get. For example, the common cold doesn't even apply as common. It's because you basically just get it by going outside. I mean, me being a pediatrician, we'll see kids getting sick. They'll get sick once a month, right? They can get sick with the same kind of thing. Because that's why we call it more common. When we talk about rare from an ID perspective, it's something that doesn't occur as frequently. Meaning, you may have one case every 5 or 6 years. I mean, I've been doing this for the last, in Novant for now almost 8 years, and with my studies and all that, I've been in ID for 11. I haven't seen a case of hantavirus throughout all this time, right? That's how rare it is, right? There are a lot more cases depending on, again, the need for that vector, right? So yes, in more, we'll say rural or high risk situations or populations, meaning, where we'll see this, if we think about like during the plague, right? One of the reasons there was a big outbreak was because there are a lot more issues with rodent infestation. So places that have a lot more rodent infestation or issues with rodents, that's where you'll see it a lot more. So, I think the couple that they're calling the couple, or the patient that, or patient zero, if you want to call it like that, from the cruise. It is suspected that they got it from a landfill while they were bird watching, right? So if think about a landfill, right, we're thinking about a dirty place where you're gonna most likely be a lot around a lot of vermin, a lot of rodents, right? And again, I mentioned the rodents because that's important, because it's not just the act of them being there. it's what they leave behind, right? So you can actually get it from the bite of the rodent, from the saliva of the rodent, but you can also get it from the urine of the rodent or even their droppings, right? So you can actually inhale the virus from the droppings of that. All right. So another things that we, would see is if you go to these like old places, let's say like an Airbnb, for example, that's not been properly cared. Because I know a lot of people talk about cabins or moving forward, like how do I avoid this? I know that's the biggest question a lot of people have nowadays with this coming out is okay, are we in a place where you're seeing a lot of rat or mice droppings, right? Our instinct is to kind of clean it up, right? Sometimes that cleaning it up can actually create that dust, which can actually release the particles, and you can actually inhale the particles as well. So there's basically I don't like to say it has to be a dirty place, but basically it's a place that you're not have the highest hygiene, right? That's where you might be localized. So that's why it's rare, because it's not something that you'll just see just by walking in the, let's say walking into the mall. You're not going to potentially see something like that.
All right, yeah, okay. So it has to be filthy because I heard Airbnb and I'm like, oh man, I just had a. I
But
know a lot of
yeah, it has
folks.
to be on the filthy side, right? It's a place that you need to make sure that basically the vector has to be there. That's why it's rare, because there needs to be that vector, right? It's not just because, again, the common cold, you just get it because it's the viruses are all around us, but this actually needs that vector. So you need to be in a place that actually is going to substantiate that. So again, rodents really like those, like landfills, for example. That's where this couple, and I think it's from Denmark, I think they're from. That's where they've gotten it, because they were in this place, right? So it has to be, a dirty place. And the thing about hantavirus in general is that it's not a person-to-person transmission, right? Let's say, the majority of hantavirus is vector borne. So again, requires the vermin. However, there is concerns about this particular strain because of where they may have gotten it, which it was in Argentina. So like I mentioned in the beginning, it depends on geographic location. There are different strains. In Argentina, there is what they call the Andes strain, and that one has been shown to potentially cause person-to-person transmission, right? So that one's a little unique in that aspect. So yes, I know that's the biggest concern with this one, is because there could have been a lot more people getting infected, and I think they mentioned that they may have um, three other people that may have gotten infected as well in that cruise ship. So that's why they're thinking about this being more the Andes virus, because it could have been more person or person. But in general, hantavirus in general, more vector borne. So that's why, again, on the rare end, because it's not something that you will commonly see.
Man, you cleared up a lot of questions for myself that I could take to head to the group chat, because I've been getting questions in my group chat. I'm like, I can't wait for this interview so I can answer some of these questions, and I'm sure a lot of folks at home are feeling the same way. Dr. Rivera-Chaparro, thank you with Novant Health. Thank you for your time. Thank you for the information, for the insight. Again, clearing up a lot of questions for folks out there.
Sure. Any other questions you have for me?
That's it. I'm good for now. I'm good for now. But thank you again for your time. Thank you for joining us here on Live Impact News.